Association between exercise and low back pain resulting in modified duty and lost time using the McMaster's Critical Appraisal tool. It was published in the Journal of Occupational and Environmental Medicine in October 2018, making it a recent source of literature. To address the authors, all had their respective qualification adjacent to their name and reported no conflict of interest. Below is a full citation of the article. The McMaster's Critical Appraisal tool was chosen as it allows for both qualitative and quantitative critical appraisal reviews. It is also appropriate for a cross-sectional study such as the article of focus. The McMaster's Critical Appraisal tool can be found using the link below. The study purpose was explicitly stated in the introduction and reads, "The cross-sectional study aimed to assess the relationship between leisure time exercise and whether workers had ever had modified duty or lost time due to lower back pain in an occupational cohort." This article was used as a reference for our study proposal due to the relevance to our research question, how does back pain influence whether or not people participate in physical activity? This is portrayed as both studies were aiming to assess a relationship between exercise and back pain. The study at hand measures the impact that exercise has on those with lower back pain in relation to modified duty or lost time in their occupation. Our study aimed to identify how back pain impacted participation in physical activity. The nature of the two studies show they may have been a two-way association between exercise and back pain and how they influence participation across different domains. The background literature summarised the prevalence of lower back pain and the impact on workplace productivity and lost work days as a result. This contributed to an understanding of why lower back pain is an issue to the occupational population. It introduced the exercise guidelines for general health and recognised the current link between graded exercise therapy for chronic lower back pain and acknowledged that chronic lower back pain has been documented to improve with exercise therapy. This portrayed the relevant relationship between exercise and lower back pain. The authors lastly tied the literature together by clarifying that current literature examines the effectiveness of workplace exercise programs in the decrease of days absent from work. Given the relatively low quality studies and generally mixed results of such, this article's objective was to assess the relationship between leisure time exercise and whether workers have ever had modified duty or lost time due to lower back pain in an occupational cohort. The study was cross-sectional in nature and analysed baseline data from the Backworks cohort study of lower back pain. The data consisted of information gathered from questionnaires, interviews, physical examinations, health measurements, and measurement of their physical tasks. This study was an appropriate, time-efficient, and cost-effective means to gather a large variety of information from a large sample. However, it also prevents being able to directly determine causes, as it only allows for associations to be made. Other study designs of greater quality were considered. A randomized control trial would likely be too unethical due to the varying degree of injury. It may also negatively impact their capacity to fill their normal occupational duties as part of the intervention. A case control study may have been more appropriate if the aim of the study was to determine direct causes of modified duty or lost time due to low back pain, rather than make associations. Due to obtaining data from a previous study, the sample for the cross-sectional study was a convenience sample. However, the participants were initially recruited by 27 different employers at 30 different production facilities in the United States of America in Illinois, Texas, Utah, and Wisconsin. Furthermore, participants were chosen from a variety of jobs such as poultry and meat processing, manufacturing, baking, printing, and grocery warehousing, which facilitated a greater degree of generalizability. However, this still shows a degree of selection bias, as many occupations were not considered. Selection bias was also present at these physically demanding occupations consist mostly of males, and this was reflected as 63.8% of the sample were males. Inclusion criteria from this study was on the basis that participants were 18 years of age or over, able to give informed consent, no plans to leave or retire within 4 years, able to speak English or Spanish, and no limb deformities or amputations. Participants who did not meet this criteria or whose lower back pain was caused from motor vehicle or other accidents were excluded from the study. Additional exclusion criteria was incomplete data due to missing information regarding exercise habits and duration. The ethics procedure of the original cohort study was not outlined fully in this cross-sectional study. However, it was published in the original cohort study that has its reference provided. Despite this, it was stated that subjects were able to provide informed consent and written consent was obtained. Due to ethical reasonings, all subjects were aged 18 years or above. Due to the cross-sectional study design, there was no physical intervention delivered. However, the data used was gathered from a previous study which used structured interviews to assess outcome measures regarding the participants' lower back pain. Researchers asked specific questions such as whether their pain resulted in a loss of work time and whether their pain impacted their participation in leisure exercise. Questions also investigated participants' presence, duration, and severity of pain and history of modified duty. An odds ratio of lost time in minutes of exercise participation was utilised. Overall, a good description was provided and was fairly replicable within Walker's study, and additional methods were referenced in the original research paper. Statistical analysis of the data was done so using a reputable program. Alpha levels, measures of central tendency, and spread, and the statistical tests used within the study were explicitly stated by the authors, therefore enhancing the methodology to enable replication. Outcome measures were taken once, which is reflected through the cross-sectional nature of the study. The primary outcome measures included whether modified or lost time had been experienced, APGAR composite scores measuring job satisfaction, pain rating on a scale of 0 to 10, measuring back pain severity, and minutes of weekly exercise. Measurement bias may be present due to the simplicity of the measurement tools, such as a 0 to 10 pain scale, which may not accurately represent that degree of severity of back pain. Further information was recorded regarding general health variables and were secondary measures. Some recall bias is present as the self-reported information may result in inaccurate measurement. This may impact the results due to under- or overestimation of information given and therefore impacts the internal validity of the study. The APGAR in particular is a recognized and validated tool for measuring psychosocial variables in workers, which was stated by the authors, hence increasing the internal validity of the study in this aspect. 827 of the 897 recruited participants were included in analysis, and the remaining 7.8% excluded due to missing information regarding exercise habits and durations. The participant demographics of the sample of the 827 were analysed to determine whether there may be confounding factors as to whether they had experienced modified duty or lost time or not. Males contributed to 63.8% of the sample, the mean age was 38.8 years, and the mean body mass index was 29.3 kilograms per metre squared. All were perceived as relatively healthy with few reporting disease or illness. However, it was noticed that 14.4% experienced hypertension, 18.7% reported high cholesterol, 4.5% were diagnosed with diabetes, 5.6% reported ever having a drinking problem, and the highest variable was smoking, with 21.5% of participants recording to be current smokers. Despite this, there was no significant differences between the group who had experienced modified duty and lost time and the group who had not, as P was greater than 0.05 for these variables. However, exercise duration had a significant effect as P equaled 0.028, showing a significant difference between the two groups. It was concluded that workers who reported having been on modified duty or lost time due to lower back pain performed less leisure time exercise at the recommended level of 150 minutes per week compared to those without modified duty and lost time. Table 3 summarised the continuous variables relating to modified duty and lost time. 16.4% of the sample reported to have had modified duty or lost time due to lower back pain. Accordingly, the pain rating scale was significantly higher in this group, where P was less than 0.001. Furthermore, the APGAR composite score was significantly higher in the group who had modified duty and lost time, where P equals 0.006, suggesting they experienced less work job satisfaction. As previously stated, in Table 2, exercise duration was a significant variable, with P equaling 0.028. This shows that generally, individuals who haven't experienced modified duty or lost time due to lower back pain complete more exercise per week than individuals who have experienced modified duty or lost time. The individual percentages of workers who completed each category of exercise was previously documented in Table 2. Table 4 displayed the relationship between the categories of weekly exercise duration in minutes and the history of modified duty or lost time. As previously mentioned, there was a significant relationship showing that workers who reported having been on modified duty or lost time due to lower back pain performed less than 150 minutes per week compared to those who hadn't experienced modified duty or lost time. Crude analysis recorded that those who completed 316 minutes or more per week were significantly less likely to have ever been on modified duty or lost time due to lower back pain, with P equaling 0.033 and 95% confidence intervals between 0.26 and 0.95. After adjusting for confounders of age, sex, pain rating, BMI, and APGAR scores, these findings remained significant as P equaled 0.032 with 95% confidence intervals between 0.23 and 0.98. The narrow confidence intervals indicate high accuracy in the sample, representing the true but unknown values for the target population. No clinical importance was reported or addressed, since the authors failed to address any clinically meaningful results or methods for measuring clinical significance. This impacted the clinical implications of the study. In other words, statistically significant results may not transfer into clinically meaningful outcomes. Dropouts were not applicable as no physical intervention was delivered. However, data was excluded based on the aforementioned inclusion and exclusion criteria. Walker et al. Concluded in this study that increasing amounts of recreational exercise can reduce modified duty and lost time from lower back pain. Although concrete conclusions are unable to be drawn from the results, this may suggest exercise as a preventative measure and encourages employee participation in physical activity. Should this be the case, modified duty or lost time due to low back pain may be reduced and therefore indemnity costs also reduced. This study, however, was limited by recall bias and potential over- or underestimation of the duration of exercise, particularly by overweight individuals and other possible confounding variables. This study also utilized a convenient sample which impacts the validity of results, as the sample may not provide an accurate representation of the target population. Another limitation that can be identified with cross-sectional studies is that because the exposure and the outcome are simultaneously assessed, there is generally no evidence of a temporal relationship, meaning that without longitudinal data, there is no way of establishing the true cause and effect relationship. The authors addressed that the large sample size of 827 participants from over 4 different states with a variety of occupational backgrounds increases generalizability of the results. However, they failed to address possible selection bias that may have occurred due to the convenient sample strategy. Lastly, measurement bias was not addressed in regards to the outcome measures, although recall bias was adequately revealed by the authors, including the potential impact it had on results. Physiotherapists utilize an evidence-based practice model. Therefore, in order to successfully apply this technique in future allied health rehabilitation for patients that present with lower back pain, more evidence is needed to identify the specific causes and outcomes of the relationship between recreational exercise and lower back pain. To accomplish this, further in-depth research into specific types of exercise, such as resistance and aerobic training, and the effects of preventative exercise were also recommended by the author to gain a greater understanding of the association between exercise and lower back pain. The cross-sectional nature of the study has also been identified as a major implication for clinical practice due to the inability to determine causality. Future research may benefit from the use of experimental studies within ethical reasoning or appropriate case control or cohort studies to provide a higher quality evidence base for the use of health professionals. To enhance understanding of the relationship between leisure time exercise and the experience of modified duty and lost time due to low back pain, qualitative studies would be useful in understanding the experience of workers in these situations. The McMaster's critical appraisal tool included a good foundation to enable critical appraisal of an article. The layout was easy to follow and follows the general structure of articles. Areas of improvement could include adding a prompting question regarding the prevalence of measurement bias in the outcomes section. This may strengthen its use and encourage greater depths of analysis within the methodology and sources of potential bias. Furthermore, although the critical appraisal tool addressed whether authors reported dropouts, there was no direct mention of inclusion or exclusion criteria. Including inclusion and exclusion criteria may further facilitate the analysis of any selection bias which was present. The tool could also be improved if the reputability of authors was addressed, including their level of expertise, whether any conflict of interest was reported, and whether the study received any funding. Lastly, a critical appraisal tool score would allow users to conclude the critical appraisal of an article with a conclusive idea of the overall quality of the literature. Collectively, these additions would improve the quality of the McMaster's critical appraisal tool.